Are you ready to revolutionize your relationship with money? Welcome to the Finding Financial Freedom podcast with the Frugal Physician, where I, Dr. Disha Spath, will be your companion on this exciting adventure. Get ready to conquer debt, build wealth, and embrace a mindful spending lifestyle that will empower you to live life on your own terms. Pearson Ravitz's story begins with Dr. Stephanie Pearson, a passionate OB-GYN at the height of her career. But then, a shoulder injury struck during a precipitous delivery. Her dreams were shattered, leaving her unable to practice medicine. Determined to make a difference, Stephanie became an advocate for her peers, guiding them through the complex disability process. Alongside insurance expert Scott Ravitz, Stephanie founded Pearson Ravitz, a company determined to approach insurance differently. Together, they set their mission to educate and empower physicians to protect their most valuable asset, their income, and the most important people in their life, their family. Today, Pearson Ravitz serves the medical community in all 50 states. At Pearson Ravitz, they understand the unique concerns of physicians. Physician-founded and physician-focused, Pearson Ravitz builds human connections before they create quotes. Life can change in an instant. It's hard to imagine that a sudden illness or injury could leave you and your family in a devastating financial situation. But with a little planning and guidance, you can prepare for every possibility. Visit PearsonRavitz.com to schedule your consultation with a Pearson Ravitz advisor. Hello, friends. I'm your host, Dr. Disha, bringing you another episode of Finding Financial Freedom with the Frugal Physician. We're shaking up the status quo with a fabulous Dr. Sanghamitra Sadhu. She's not just treating patients, she's treating the system. Dr. Sadhu has carved out a niche in the world of medicine where joy meets job satisfaction through her lean private practice model. Here's a little bit more about her. Dr. Sanghamitra Sadhu is a nephrologist, blogger, and a whirlwind of positive energy and change. Dr. Sadhu has transformed her medical career into an enviable blend of professional fulfillment and personal happiness. Her secret weapon? A lean private practice model that zaps burnout and amps up life's joys. She doesn't stop there. She launched Link Medical Spaces, slashing the hefty price tag of medical office space for healthcare professionals everywhere. Ready to get inspired? Let's get going. Hi, Dr. Sadhu. How are you?
I'm great. Thank you so much for having me here, Dr. Spath. I'm really excited.
Oh, absolutely. Can we go by first names? I'm Disha.
And just call me Mitra.
All right. Let's start from the beginning. What sparked your move towards lean private practice?
So right after I finished my training in nephrology, my fellowship from the University of Miami and Jackson Memorial Hospital, I had my children and stayed home with them for a little bit. So I had some time on my hands at that time. And we know a lot of physicians because both my husband and I are physicians, so both in real life and in social media. I'm part of so many physician groups. And the resounding theme seemed to be this thing called burnout. Everybody who was working a bunch, which was most people, seemed to be not entirely happy about it. And it was such an echo that I was like, all right, if I get into this, seems like a death trap, I'm going to go down the same road. And I didn't want to. I always knew that I wanted to work part-time. I've always been the primary parent for my children. My husband, he makes up for both of us, works quite a bit in his job. So I always knew that I wanted to work part-time. So I started off slow. Did some independent contractor gigs around town that gave me flexibility and time with them. And that was going great. But a few years into it, I wanted to do some more. So I looked at my options and interviewed with some groups. And I realized I came to this conclusion that there were broadly two choices. I could either work 100 hours a week and go down the partnership track, probably fall into the same conundrum that everybody is in, or I could work what they call mommy hours and work a little bit, get paid accordingly, just stay there. But that was the problem. There was no growth potential there. It was going to be just that for the foreseeable future. And not only that, it was actually heavily discounted for the privilege of working part-time. This is a well-known phenomenon that has been described not only in our profession, but in multiple places. So I realized that I probably have to create my own solution. Wanted to have my cake and eat it too. And ownership drives me. It motivates me. So I automatically then thought of creating my own practice or having my own practice. Now, as a practice owner, if I wanted to work part-time, I was going to have to think outside the box and basically tighten the belt and consider my expenses very carefully. So that was the birth of my lean practice. I did not premeditate it as such. I focused on the two biggest expenses for small practices, namely office space and staff or personnel. So for office space, I work out of a shared workspace location and I keep my rent really low. And for the personnel issue, I started off as a micro practice. I did all of it front to back in the beginning, from answering phone calls to doing the billing to all of it. I still do my own billing. But when the volume got to a point where it was taking up my evenings and weekends, I was like, all right, that's not the goal. And so at that point, I hired a virtual assistant to take a bunch of things off my plate. And at this time, I am in a happy medium. I see patients twice a week in the office, spend some more time doing admin stuff, but on my own time, whether when the kids are at school or at home, along with them when they're doing homework. So it works out.
Wow. Well, so many things that you said really resonated with me. When you talked about how, there was either the option of burning out or doing it your own way. I mean, you're totally right. I witnessed it when I was in medical school too. Actually, after the first 2 years of training, I took a year off right before third year because honestly, everyone seemed so unhappy and I didn't know if this is the right path for me. I was asking myself, am I choosing the right thing? Because everywhere you looked, everyone seemed burned out. You mentioned growth potential. And it's funny because I mentioned that during an interview recently for a full-time primary care job. And I was like, is there any growth potential? And they sort of just looked at me blankly, like, where else would you want to grow? And while I'm privileged to be a physician and be entrusted with people's lives, like you, I do have an entrepreneurial drive and don't want to just grind it out 100 hours a week for the rest of my life. So I can totally relate to that. And I'm sure a lot of listeners can too. It's really interesting to me how you just did it your own way and went into this lean private practice model. And you kind of broke it down for us. You said you kept your overhead low with the shared space and with the staffing. Are you still at that level of staffing when you don't have a nurse, you don't have an MA, you don't have people rooming your patients or anything like that?
That's right. I am still at the same level. I do not have any in-office staff. Fortunately, the shared workspace comes with a receptionist. So they let me know when there's a new patient or when one of my patients is waiting in the waiting room and I go get them. The patients love it. In fact, the reviews will mention, have you ever had a doctor come get you from the waiting room?
You get a personal touch.
Right. They love the time and the attention because I think that's one of the things that really affects patients these days with the changes in medicine. So I go get them, walk them down the hallway, get the small talk out of the way, take them to the room. I, in fact, start with history, let the blood pressure come down to baseline before I check a blood pressure, make a plan, give them their appointment, all of it, really take their copay, give them the next appointment, take them back to the waiting room, and say bye-bye.
Wow. So are you billing regular insurance? Are you participating in Medicare and Medicaid?
That's right. I am only insurance-based. In fact, there is no cash pay component at all.
Wow. And you pay a virtual assistant? Is this virtual assistant in the country?
Yeah, she's located overseas.
Okay. And how much does that cost, the billing service? Because I understand that can be quite expensive.
So she's not a billing service. She is a virtual assistant who's paid hourly. Billing services are mostly a percentage-based thing, right? So I do my own billing. I taught myself in the beginning, and at this time, it appears doable. It has turned into a task that takes up some time, and at some point, I will be ready to give it up. But my billing is fairly simple. It's only office codes. It feels doable. Most of it is really, really automated. You actually delve into the process, unless somebody is doing a bunch of procedures that are expensive and stuff like that. It's only the few denials that are the bane of our existence. But fortunately for me, that number is very, very low because of the simplicity of what I do.
Nice. So you don't do any office-based procedures. Do you do any labs in your office?
I do not. I do not do labs in the office. There, and the patients go out to labs, the standalone labs of the hospital systems.
I see. And are you the only partner in your practice? Only physician?
Yes, I am.
So are you on call 24/7 then?
So I'm outpatient only, which is the saving grace. But yes, technically I am on call 24/7. The acuity is not very much, which is a good thing. I do cover myself on vacation as well. And that also I find doable because it doesn't take me much. I check my inbox maybe once a day in the morning on vacation, handovers or sort out things and pass them on to the virtual assistant if something needs to be taken care of, do a few refills, not that I necessarily need to on vacation. I think labs are the critical aspect for me, being nephrology, and make sure nothing is missed from that angle. But yeah, all of it takes barely 20 minutes or so a day. Most other things for patient messages, etc., get saved, an automated saved response that says, hey, Dr. Sadhu is on vacation and will return on such and such date and take care of it when she gets back. If it's an emergency, please seek urgent medical care.
Wow, that's an amazing system. How does it pay from your lean private practice compared to what you were making in the employee space?
I am making far more with less work than working for someone else. I wasn't expecting that. I got into it, one, to be my own boss, not to have to ask anybody else permission to take vacation, and two, to frame it according to my own terms, work-life balance kind of thing. Gradually, I've realized that with the pay, it's not necessarily that they were giving me a bad deal. It's probably that in general, the overheads of practices are so high that they're not able to pay their physicians or employees that well. So yeah, I'm making more than I was with less work.
Wow, what a hack. I mean, if you have the guts to do it, it sounds like a win-win situation. What about benefits and healthcare?
That's a good point. So I rely on the hubs for benefits like healthcare. I pay for my own malpractice, etc. However, like any other solo practice, one could probably get health insurance and stuff from the marketplace. And that should not be different for a lean practice than any other.
I want to back up and just ask, how did you learn about billing? And were there any resources you could share with our listeners so that they could learn about it as well?
Google is a good friend. I did not use any specific resource or anything comprehensive. The EMR was actually pretty helpful. So I use an EMR that is tied to a practice management system / clearinghouse, and it's all together. And it wasn't hard. I saw a claim form for the first time and went box by box and okay, this can be done. Most of it is demographics. The thing is, we're smart people. We can figure things out. We can learn. We've dealt with fact books before. These are not the hardest things. In fact, like they say in personal finance, they say doctors are not good at finance. It's not that hard. It's just that we have not had the time or taken the time to learn it. But when we put our minds to it, we get it. So practice management is very, very similar. It's not hard. It's just that most or many physicians can get away with it kind of in an employed setting or think they can. However, I think some of this is so vital that everybody should know it. Because after all, what happens after you see the patient and after you sign the note is what's getting you paid. And how do you determine your worth if you don't know how you're getting paid and how much that is and what the delta is between that number and what they're paying you? So that's how I got there. And I'm still learning a little bit every day.
Yeah, and oftentimes that delta is hidden on purpose, right? Because your employers don't really want you to know how much money you're making them. And thankfully, thanks to all the resources that are out there now, all the doctors that are teaching each other, I feel like that information is more accessible, or at least the general numbers are more known. The physician advocacy is getting us somewhere. I really appreciate you sharing your business model and your insights with us about your practice, because even if people decide to stay with their employer, it's totally a valid choice if that's what they want to do, but at least you know the other side and what the benefits and the drawbacks might be of your options. That creates a lot of mental freedom as well. So thank you.
Forget the burdens of tenants and toilets. Equity Multiple simplifies your investment journey, letting you invest passively in vetted, professionally managed commercial real estate. Only 5% of reviewed investments reach Equity Multiple's platform, with our asset management working on each from funding through exit to maximize your returns. Whether you're on the couch in your exec chair or the backseat of a ride share, Equity Multiple brings cash-flowing real estate investments straight to your fingertips. All investments involve risk. Visit equitymultiple.com to learn more.
Let's switch gears and talk about your Link Medical Spaces business. What drove you to start it, and how is it revolutionizing office space for healthcare?
Well, I certainly hope it revolutionizes the medical office space. I just launched this service to help out doctors in private practice. So it starts from my own experience. When I was first starting out, I was actually looking to sublet from an established practice. That would have been ideal. I was not starting off with a patient panel, so I knew it would take time to build up. I wanted to start off with a couple of half days and build from there. But I had no resource to connect me to such space, even if it was available in my neck of the woods. I cold called a few practices. The response was just about lukewarm. It's a new idea after all. So it didn't go anywhere. And finally, when I found out about the shared workspace, I just went with it. And that is what sparked the idea. And I've had that idea in there for this long, and it's taken me all this time to bring it to fruition. So it's a simple idea. Link Medical Spaces is an online platform, the only one of its kind specific for medical office space, where if you have some medical office space, whether it's a full suite or part of a suite, whether it's available full-time or only part-time, you can list it on the site. Again, since it's specific for medical office space, you are putting it right in front of your ideal audience, which is actually all healthcare professionals. So I am hoping that the benefit is dual from the side that I'm coming, a small practice or a lean practice, or somebody who wants to work part-time for whatever reason, or is just starting out, or even an established practice that is trying to set up a footprint in another part of town, a satellite location. It's perfect for all of those scenarios. Office space is expensive in general, and medical office space, like most things medical, has the doctor price tag and is a premium. Especially starting off, if a young doc who already has student loans can avoid getting a practice loan because they can, avoid the building cost part of it, at least in the beginning, then that is so great. Once you're making money, then by all means, go for it, get the space that you need to grow and fulfill your vision. On the other side, on the established practices, back in the day, it was fine. There were a couple of exam rooms at the bottom, at the end of the hallway, which were lying empty, and it didn't matter very much. Now, every single expense matters because the profit margin for private practice is so thin and going down with the cost of doing business going up and reimbursements going down. So if you can empty out those rooms, dust them off and make them into exam rooms, and in the process help out a colleague who's starting out, then it's a win-win. Some other ideas are if you want to bring in, say, a different kind of service, say if you're primary care and you want to bring in a therapist or a dietitian or a physical therapist, something that adds value to your own patients, then you're increasing foot traffic in the office, you're getting patients some added value. And last but not least, the way to market office space generally is with the help of a realtor, and realtors get a percentage of the lease value for the entire term of the lease. So a certain percentage for like all 10 years that your tenant is in there, that adds up to thousands of dollars. Again, aligning with the same mission. I was like, that's a bit much. This listing price is a low monthly fee for only as long as you need to have the listing up there. And that's it. You're not looking at anything long term. So I'm hoping that these things will be of value.
Yeah, Mitra, that's genius. It's like Airbnb for doctors and office space. It's opening up a whole new world of opportunity in my mind, But honestly, I've been thinking about starting on my own path for a little while now. And the initial startup costs of buying a place and setting it up is kind of intimidating. And what if I don't want to dive in completely? What if I just want to do it 1 or 2 days a week and see how it does and then fully commit when I know it's going to work? If I can find a space to do it for 1 or 2 days a week instead of buying a place, or even buy a place and rent it out to others on your platform and have it be used for the entire week, that's an absolutely genius idea. And I hope it takes off. How many sites do you have listed thus far?
I just have 2 this time. It's been just a few weeks. It's so obviously awareness that it exists, but also it's the mindset shift that is needed for so many things that we would like to change in private practice. I think the days of waste and redundancy in private practice are gone. The innovations are going to look different, and they're going to be small changes in the beginning on an individual basis. Everybody's going to come up with a solution that works for them. This is before the big systemic changes can take place. So yes, even with Link, I think it is more of, should I let somebody into my office? How would it work? But hash out the steps. It's really simple. It's a shared workspace arrangement. You want to make sure that it's a fair market value. So there's no question of star clause and stuff coming in. And you want to price out the place properly using comps, just like you would do if you were to put a house for rent or on the market, prorated for how much time the other user is going to be in there per week or so. That's it. And the ancillary things like what else you're going to include and stuff, it's small issues.
I hope it takes off, and I hope we can help you spread the word even more. So if you have office space, make sure to look up Mitra and her website. Remind us again what the website was.
It's linkmedicalspaces.com.
Well, it sounds like there are a lot of positives here, a lot of positives in doing your own thing, but often this can be quite scary. Can you please share with us a particularly challenging moment When you made the switch to lean practice and doing your own thing, how did you tackle the mental aspect of it?
Happy to talk about that. Again, I think more than something physical, it was a mindset thing. I didn't start out with talking about or being willing to talk about my practice setup openly on the internet. I was, if I may say so, embarrassed about my practice setup in the beginning. I was like, who even does this? And I showed up that way when patients asked, and I thanked them for it. They'd outright ask, hey, doc, can I ask something? Why are you here? And I'd mumble something and starting off or something like that. But gradually, I realized that I was providing the value that I was meant to provide. I was taking care of my patients just as well, probably even better than I could in a traditional setup. And I say that because I was not having to squeeze in 30 patients a day to make my overhead, whether it's in my own practice or working for someone else. I am able to give more time to patients than is often considered feasible in an insurance-based practice. When I realized this, that the core reason I'm doing this is intact, that's when I began to show up differently. I realized that, the rest is all flush. That took some time, some coaching, and I think in general, time helped. External validation helped too. The reviews started coming in. The feedback from referring physicians started coming in. So all of that helped. And I was like, all right, maybe this is not something so ludicrous and maybe it can work.
Yeah, you're so right. The mental hurdle, getting over other people's expectations, and learning how to respond with your own confidence, with your own self-assuredness, that takes some time. And there's so many ways we have to battle that in our lives, between choosing when to and where to spend money, choosing to be frugal or not, choosing your own path in business, choosing your own path in medicine. All of it has to do with being confident in your thoughts, right? In your own decisions, in your own perspective, and leading from that, making sure you understand what's valuable to you and then sticking by those. And then, let other people talk. Let them say whatever they want because you're doing what you're meant to do. So to our listeners itching to revamp their practice, what's the first step they can take towards embracing the lean model?
So again, the way I did it was to focus on the biggest expenses. You know how they say focus on house and car and you don't need to worry about the number of lattes you drink. It's similar. Focus on the big expenses. In fact, I like the idea of being able to pay my employee maybe a little more than average because I am saving on other big expenses like the rent. Teaching oneself the basics, I don't think that's the hardest part. I think the mental aspect is probably the biggest deal. Knowing that you want to do this or getting to the point where you're okay doing this, then just going for it. It's easy.
Are there any last words of wisdom you'd like to leave with our audience today?
So I want everybody to remember there's a way out of burnout. You have choices no matter how far backed into a corner you feel. Private practice is actually worth it. It's hard to put a price tag on the autonomy. And innovation is key. Medicine 2.0 is going to look different. If you want to start a practice or if you're already in private practice, think differently and you'll find a solution for yourself. And who knows, that maybe the solution so many others are also looking for, because at the end of the day, our patients are just, wanting to get taken care of well, but it's going to take some time for us as a society in general to find these changes either comfortable or run us the mill.
Yeah, absolutely. I mean, I feel like our profession has been taken over by corporatization, and that has heavily influenced our practice because people are trying to get lean at our expense, increase their profit margins for Wall Street. But it is still completely viable, I think, for physicians to take back medicine and start opening private practices again and not get swallowed up by conglomerates. I think it's possible, especially if you focus on staying lean and staying frugal and noting things that you can do that you can cut down some overhead expenses. Thank you for reminding us of that. And again, remind our listeners where they can find you if they want to get in touch with you.
Absolutely. Thank you, Disha. This was amazing and great fun talking to you. So I am easy to reach either at hello@linkmedicalspaces.com or my blog, which is leanprivatepracticesolutions.com. There, my email is editor@leanprivatepracticesolutions.com. And I also spend way too much time on Facebook, so feel free to send me a message there if it's easy. Sanghamitra Sadhu.
Wow, what a fantastic episode with Dr. Sadhu. For all of you wanting to get inspired to retool your medical practice, or just curious about innovative healthcare solutions, check out Dr. Sadhu's work at Lean Private Practice Solutions and Link Medical Spaces. We'll have those links in the show notes so it's easy to find. That's it for today. Love what you've heard? Hit subscribe and never miss out on our journey to financial freedom. Oh, and one more thing. Before I let you go, do you mind opening up your podcast app on your phone and dropping a review? I absolutely love doing the podcast, and I love hearing from you in our community and your views. Help me expand by bumping the show rankings up. I would be so thankful if you get around to it. Thanks for joining us on this journey to a wealthier life. Keep pushing boundaries, saving lives, and stay frugal, y'all. Now, a final word from our sponsor. At Pearson Rabbits, they understand that life can change in an instant. It's hard to imagine that a sudden illness, injury, or catastrophic event could put you and your family in a devastating financial situation. Physician-founded and physician-focused, Pearson Rabbits builds human connections before they create quotes. Visit www.pearsonrabbits.com today and embark on your journey to safeguarding your future.
The content shared on this podcast should not be taken as individualized financial advice. We are here to share our knowledge and experiences, but it is crucial to consult with professionals such as accountants, financial advisors, or attorneys who can provide personalized guidance based on your specific needs.